What I'd like to do today is to present an overview of some of our new research, which is examining an online interactive web resource called iSupport. And I don't seem to be able to move the screen on now. Ah, there we go. And this is designed to reduce distress in dementia carers. So for the next 15 minutes or so, I'd like to give an overview of the team involved in the study, why we're actually doing this work, and in particular, some of the challenges faced by dementia carers. I'll give a quick overview of the World Health Organization's response to this challenge, and then what our work programme will do. This work started just back in January, and it runs for 3 years, and it is funded by the NIHR in England. So who's involved? Well, it's a large programme in the UK, and it's led by myself at Bangor University in Wales, with colleagues from the Clinical Trials Unit, Health Economics, and my research centre. We have other investigators and organisations in England and Scotland who are also highlighted here. And importantly, we've got partnerships with Alzheimer's Scotland and the Carers Trust, who will really play a critical role in helping to recruit our participants to this study. And importantly, we're working with the World Health Organization, who are providing their expertise and support here. And I don't think I need to kind of really reinforce this point to the audience at this event, but dementia is a global health challenge seen as an international public health priority. And according to figures from Alzheimer's Disease International, it's estimated that almost 50 million people were living with dementia in 2017. The numbers are estimated to be doubling every 20 years, reaching around 75 million in 2030 and 131.5 million in 2050. So please excuse these alarmist figures, but they're really to state that the challenge that we face. And it's particularly pertinent to lower middle income countries whose service infrastructure is often much less developed than ours in the West. And of course, we know that most people living with a dementia will be living in their own home, supported by a family member. And most of us, of course, we haven't trained to be a carer. We haven't trained for this caring role. It isn't something we would necessarily have chosen, but for many people, here we are. And often as a consequence, and what we know from hundreds of research studies, is that caring can be very stressful and is associated with a myriad of poor mental and physical health outcomes. And also the financial costs of care are considerable, with 11.6 billion of the total cost of care in the UK contributed by the work of unpaid carers, so that's family carers of people with dementia, and that's higher than that spent on health and social care costs. And in Wales, this unpaid care accounts for 3/4 of the total costs of care for people with dementia living in the community. So carers are doing an awful lot, which is clearly a benefit to society, but they're often doing this alongside their own health problems, trying to juggle their work and family commitments, and probably finding very little time to take a moment for their own self-care and well-being. And so the importance of supporting carers is recognised globally by the World Health Organization and also nationally in our dementia plan for Wales. So what do carers need? We know from the considerable body of research which has captured the voices of carers when they are asked what they need to help them. Not surprisingly, of course, they need help in many areas of life. And here in this paper called Hearing Their Voice, the authors undertook a systematic review of the work of others to investigate the perceived needs as reported by family carers of people living with dementia. And for those of you unfamiliar with this method, a systematic review is a desk-based method where researchers access thousands of journal articles through scientific databases and identify relevant studies by searching using keywords. So in this study, they developed this paper based on 12 qualitative research studies, which included 177 carers aged between 27 and 87. And they drew all the findings from what these carers had said about what they needed together. And they identified a number of common themes, specifically the need for relevant information and knowledge, support with management of care recipients' functioning, behavioural and psychological symptoms, support with their own physical and mental health, and support with regarding their unbalanced social life. So self-care again. And these areas of need are those our iSupport research programme aims to respond to. So let me tell you a little bit about our support. This is an online skills development and self-care programme, and it's developed by the World Health Organization, designed specifically for dementia caregivers. And there's a strong evidence base regarding the development of iSupport. So it's very much can be described as an evidence-informed product. And how iSupport is expected to be effective is reflected in the ways the programme is built around person-centred care, which recognises that dementia care should reflect the individual's needs, personality and ability. There are self-care techniques which are based on different therapies, such as psychoeducation, relaxation, behavioural activation, which is an evidence-based treatment for depression, and also cognitive reframing and problem solving. And iSupport consists of 5 main themes and accompanying exercises. There's an introduction to dementia, there's a section on being a carer, there's one on caring for me, providing everyday care, and dealing with behaviour changes. And each session can take between 5 to 15 minutes, and it has a similar format where there's information about a topic presented, there's a short interactive exercises and questions with instant feedback on responses, and a relaxation exercise. And iSupport is very much based on personal choice. So carers can construct their own plan and access which sessions they feel are most relevant to them at that point in time, so they don't have to follow it in a linear course order. And the programme can be followed via the internet using a personal computer or tablet or a mobile phone. And in the UK, the National Institute of Health and Care Excellence, who set our clinical guidance, recommends that informal carers of people living with dementia, so that's family and friend carers, should be offered training and psychoeducation to help them develop care skills and manage their own physical and mental health. But of course, all these products need to be evidence-based, and this is where the science is important. So how good is iSupport? Does it actually work? Lots of organisations, they produce nice booklets and leaflets. So is iSupport actually better? Does it work better than just reading a leaflet and so on? And if we want answers to these questions, then we need to undertake the research to test it out. So this is where we come in. What are we going to do for the next 3 years? So the study is comprised of 4 work streams, and that is across 3 research sites in England, Wales and Scotland. And I'll quickly run through these work streams for you. And the first one is a randomised controlled trial where we're looking at the effectiveness of iSupport. And this will determine whether iSupport is effective in reducing symptoms of distress, anxiety and depressive symptoms, whether iSupport is effective in improving dementia knowledge, the quality of the relationship between the carer and the person living with dementia, and also carer resilience. We are also translating iSupport into Welsh because around 1/5 of the population in Wales speak Welsh, and the Welsh Government is committed to offering bilingual services as part of their health and social care provision in this country. And also, as part of the trial, we're going to have what's known as a 6-month internal pilot at the start to ensure we're able to recruit all our participants as planned. We're also, as well as seeing whether it's effective in helping caregivers, we want to know whether it's cost effective. So we're going to calculate the cost of implementing iSupport, including the technical support and time spent supporting carers to use it. Explore patterns of health and social care resource use for carers in both aspects of the study, and also the care recipients, and estimate their costs. Explore other aspects that also have value, such as informal care time, types of care task, impacts on carers' leisure employment hours, and carers' willingness to pay for more support, and also to determine the cost effectiveness. And when our participants join the study, we want 350 people, so it's quite a substantial number for such a large study. And we're going to be working on recruiting people later in this year for this phase of the study. And because this is a randomized controlled trial, half of the participants will receive iSupport straight away, and half will initially receive information about dementia. So they're our comparison group. And then we assess our outcomes. So we're looking at distress, depression, anxiety, resilience, and so on. And they're completed at baseline before the participants receive either the information or iSupport. And then they'll be followed up 3 months and 6 months later for further assessments after they've been using iSupport or they've read the booklets. And importantly, the comparison group who just received the booklet at the beginning will be given access to iSupport study at the end of the assessment period too. So this enables us to have an accurate comparison with what we call an intervention group and a control group. We're also interested in understanding some of the barriers and facilitators to the implementation of iSupport at scale. So we're doing what is known as a process evaluation, where we take a subgroup of the participants who received iSupport initially and have some in-depth discussions with those people to understand their engagements and adherence with iSupport and some of the factors which might influence the delivery and function of the intervention. We're very much interested in understand what we know as the mechanisms of change. What is it that actually really makes this product work well or not? And also some of the contextual factors that might influence the scalability of iSupport into the wider context too. And we also have a smaller piece of work as part of this study, a feasibility study, because we're really interested in adapting iSupport for younger carers. Patrick, who spoke earlier, is leading this piece of work. And here we're going to recruit 30 young carers aged between the ages of 11 and 17. And importantly, we also have a young carer, Gwenllian Hughes, whose father has vascular dementia, and she's going to be working alongside us as part of this study too. And this feasibility study will explore the potential of iSupport to address the support requirements unique to young carers, work with young carers to refine iSupport to fit their needs, and identify what outcomes are most important and relevant to young carers in relation to iSupport, and explores the feasibility of the refined iSupport product. So all of this work, we hope, will generate new evidence regarding the effectiveness of this resource, which we hope will help those providing the support professionally to feel confident in recommending this product. And I think this is especially important given the current pandemic, when many carers no longer have access to usual respite, leisure and support services, and they're finding themselves distant and isolated. And I think it's also important to stress that we're not saying this is an alternative to any face-to-face support or contact. This is just another product that can help support carers. So another reason we feel this work is also very important is it relates to the international reach and significance, because the World Health Organization is currently in the process of working with 21 countries to undertake cultural adaptations and translations for implementation, countries such as Brazil, China, Qatar, and so on. So it is really good to be part of such a big movement, and we are able to benefit and learn from how these countries are working too. But far less of the countries are actually involved in research. They're just going straight to adaptation and implementation, not knowing whether or not it's actually going to work. There are some smaller pilot studies about to be underway in Brazil and Thailand and Indonesia, and there's a larger study in the Netherlands and one recently in India. But this one that I'm talking about now is the first in the UK and will contribute to this global implementation. And as I just said, we just started in January this year. So what have we done so far? It feels like we've done lots, but we've appointed a trial manager. We've established the project governance. We've submitted our research protocol and all the associated documentation for ethical approval. We're in the process of recruiting 3 research assistants to each of the areas, the 3 countries. We also now have a PhD student who's looking at adapting iSupport for carers of people with rarer or younger onset dementia. And we're just in the process of translating iSupport into Welsh, which I mentioned sooner. So we've had the professional translation done, but we now need further work to validate this. So we're on the look for any Welsh speakers who may be interested in contributing to this phase of work. So thank you very much for your time. I realise that is a very, very quick run through of a large programme of work, and I haven't been able to share everything. So please do get in touch if you have any questions, and I'm sure there's some questions in the chat bar too.